Guys, this week I have the discussion post for variable ratio. The book defines variable ratio as a schedule of reinforcement that requires the completion of a variable number of responses to produce a reinforcer. That can be found on page 304 of our textbook. This means that the reinforcer is provided after a mean or an average number of responses. Typically, a variable ratio doesn't produce a post-reinforcement pause that we typically see in fixed ratio schedules, and the response remains steady because the participant is hoping that the response produces the reinforcement on the next turn. Examples would be for a clinical aspect, a patient is given tokens on a VR10 for keeping their clothing on. When the child does not engage at the 9 or maybe 10 or maybe 11-minute mark, then they would get access to 2 minutes of iPad videos. In this case, the iPad videos would be the reinforcer. The targeted amount of time for not disrobing is set for the 10 minutes. However, the reinforcer can be delivered at any point within those 3 different minute check-ins. A real-world example would be social media. Social media notifications are an example of a variable ratio. A post can be made, and due to the algorithm, the post receives more or less engagement. When posts receive that more engagement, then the behavior is more likely to be reinforced and happen again because they're not knowing whether or not that post will be the post that gets more engagement. And in everyday life, in an everyday job role, the BCBA behavior analysis would implement variable ratio schedules for reducing targeted behaviors that would not be appropriate, let's say in the classroom setting. For instance, sitting at a desk. The behavior can then be shaped to using different reinforcement schedules in order to generalize the behavior in all social settings. Variable ratios can also be used as in a supervisor role when making monthly teammate acknowledgments. BCBA that recognizing their RBTs can make that team bond stronger and therefore overall provide quality therapy.